we continue to dedicate coverage, arming you with all the information you need to get your vaccine.
We have new specialists on new variants to vaccination efforts underway in rural Utah and what one local school district is doing to keep their staff and students safe while preserving the school experience. Now, some good news on the fight against COVID-19. Our vaccine numbers continue to rise as more than 721,000 vaccines have been given out.
Meanwhile, our COVID cases continue to drop with 257 new cases announced today. The 7-day positive rate is down to 11%, and 5 more Utahns have lost their lives to the illness.
Right now, Salt Lake City Mayor Aaron Mendenhall, along with members of the City Council, are paying tribute to both victims and survivors of COVID-19. This is a live look outside the city and county building. They are placing lanterns to commemorate the city's lives lost during this pandemic.
The rush is on to distribute vaccines faster than variants can actually spread.
COVID case counts are down, but as news specialist Jed Bull reports, doctors are worried about a possible variant surge.
Doctors describe it as a race between the vaccines and the variant strains of the coronavirus, and they're optimistic that we can win.
And the reason it's a race is that the variants become more of a problem the more community transmission we have.
The COVID-19 variants pose one of the threats to our recovery. Dr. Brandon Webb, an infectious diseases physician at Intermountain Healthcare, tells me that ongoing vaccinations, plus our public health efforts to prevent the spread, will decrease our community transmission rate. The lower that transmission rate, the less opportunity variant strains have to outcompete the current strains.
That's the race right there. Is the lower we can drive our transmission in the community, the less opportunity these variant strains have to becoming a problem.
Vaccinations decrease the level of viral activity in the community.
That decreases the chances for a variant to emerge.
In California, a significant part of the most recent surge came from a variant. Yet, Dr. Mark Briesacker, chief physician executive with Intermountain Healthcare, points out that they are seeing the same decrease in new cases and hospitalizations as other states, which could mean the vaccines are effective against the variants.
We're watching this very carefully. The Department of Health is watching it carefully. The CDC is watching it carefully. We'll all be learning together. But for now, let's just keep vaccinating as quickly as we can.
Vaccine manufacturers also have the technology to create a booster to address variants.
That doesn't look like it is likely at this point. All of the vaccines have excellent effectiveness against the most common of these variants of concern, which is the UK variant.
Too early to tell whether we are winning that race because the capacity to screen for the variants is limited, but not seeing any clinical signs that the variants have become more common.
Without data to back it up, I would say that we do appear to be staying ahead of the curve in terms of that race.
Urging all of us to do our part in that race when our eligibility comes up. For KSL 5 News, I'm Jed Bowl.
Jed, thank you. Last week, a new health order cleared the way for schools to start having activities again if they weren't already.
Yeah, KSL News specialist Morgan Wolf spent the afternoon calling and checking in with schools on what they're doing for one of the largest high school events. Of course, we're talking about prom here, right, Morgan?
I know. I'm having flashbacks to my prom doing this story. Yeah, so I called as many of our public school districts as I could to see what their plans are. And here's what I learned from my calls. We have Alpine, Granite, Canyons, Wasatch County, South Summit, and Washington County that are for sure a yes. They are all set to go. We have a yes, but they're still being finalized for Davis with their plans for prom, and then a maybe for Salt Lake City School District as they're having ongoing conversations. Many of these districts are doing tests to sway, which is the cute little nickname that they have, asking students to get tested 48 hours before the event. Canyon School District is also taking it a step further, allowing in-state overnight travel for sports, after-school activities, or other academic organizations.
You can probably expect students and their parents are very happy with the news that this could happen for them this year.
Yes, so Washington County spokesperson also told me that they've actually had dances going throughout the year and they've ran smoothly. Now, for some of these school districts, only seniors will get to go to the prom. If you have any questions at all, I really just encourage you to reach out to your districts.
Yeah, that's exciting news. I know a lot of seniors were bummed if they would have missed their prom.
I would be.
Right, Morgan. Well, live for us with that. Thank you.
All right, one of the challenges of getting people vaccinated is making sure enough doses get to those rural parts of the state.
Yeah, for many in the rural Utah areas, it often means a long drive to the clinic. News specialist Alex Guerrero continues our team coverage live in Green River tonight. And Alex, how many hours are we talking about there for these commutes?
Ashley, normally for residents who live here in Green River, if they need something in town that's not available here, it means an hour's drive north to Price or an hour's drive south to Moab. They were prepared to do that to get their COVID vaccine until they heard they wouldn't have to.
Life moves slower in rural Utah. It's part of the appeal of living away from the big city.
This is home.
But Kathy Ryan admits sometimes that can be difficult when you need something and live in Green River.
A lot of driving.
Which is why she was planning on filling her tank to get a COVID vaccine.
I would have to go to Price or over to Castledale, Emery County if they were doing it there, or Moab or Grand Junction, wherever.
But when she found out her local medical center had the vaccine, she couldn't believe it.
So that's awesome.
And today at lunchtime, this small building off Main Street just might have been the most popular spot in town.
Because we couldn't get him here if this clinic wasn't here.
Between noon and 1.
1, 2, 3.
People lined up.
It's freedom.
Ready for masks and social distancing to eventually go away.
It's freedom to get back to life like normal.
Working with Utah's Department of Health, this clinic became a federally qualified health center for the vaccine.
We're one of the smallest community health centers in the state of Utah.
Making it easier for residents to come here for it instead of expecting them to drive at least a couple of hours round trip for it.
For our senior population who seldom like to travel out of town, that made it even more difficult.
People stayed in their cars to get the shot.
All right, little pup.
Even got smiley face Band-Aids to go along with their smiley faces.
That means road to recovery, right? For the whole U.S., I hope.
For Green River residents, it also means the road back home is shorter, something many here just aren't used to.
Being from Green River, we're not used to easy, so.
Now, the medical center vaccinated 22 people today. Again, Green River, it is not a large town, but as we've heard from health officials over and over again, every person who gets vaccinated helps society as a whole, even out here. Mike and Ashley?
Yeah, awesome to see they didn't have to make that long drive. Alex, thank you.
All right, coming up next here, there are currently two different types of vaccines, the mRNA vaccine and the adenovirus vector vaccine. What the differences are coming up next.
Plus, we're speaking with a doctor, Dr. Brandon Webb. He's a local infectious disease specialist to answer questions you might have about this vaccine.
Right now, Salt Lake City Mayor Aaron Mendenhall, along with members of the City Council, are paying tribute to both victims and survivors of COVID-19. This is a live look outside the City and County building. They are placing lanterns to commemorate the lives lost during this pandemic. In the fight against COVID, there are currently two different types of vaccines, the mRNA vaccines and Pfizer and Moderna have, and then the adenovirus vector vaccine, which is by Johnson & Johnson.
Yeah, let's talk about the differences between those two. Well, the Johnson & Johnson vaccine uses a modified virus to deliver the gene to teach our cells to make COVID antibodies. The adenovirus is a common cold virus that has been modified so you don't get sick. There are a few more viral vector vaccines in late-stage trials right now.
The mRNA vaccines are kind of a new type of vaccine. These two vaccines are the first time this technology has been approved by the FDA, but the technology has been in the works for nearly 20 years now. The mRNA vaccines teach your body to create a harmless piece of the COVID-19 virus called the spike protein, triggering your body to create antibodies to attack it. mRNA vaccines are already being looked at to create vaccines for diseases like malaria and HIV. They're much more simple to make and can be easily changed if needed, like if a new flu strain emerges mid-flu season.
I feel healthy and a lot more secure.
All right, coming up here, hear from people all across the state who have received their vaccines, what they felt, and doctors' reactions to those effects or lack thereof. As people get their vaccines, we're hearing from some they felt badly the next day, especially after that second dose. Meanwhile, others say totally fine.
Yeah, we talked to 3 people who had very different experiences and look at why they may have felt the way they did.
I am 81 and my husband's 83. We are both retired.
I'm a school teacher.
I'm 31 and I am a housing navigation specialist for a local homeless nonprofit here in Salt Lake City.
About 24 hours after I got the second shot, I had the chills and my teeth were chattering and I was feverish, but then it went away. I took some Tylenol and went to sleep early and drank plenty of water, and it was gone in 3 or 4 hours.
And the COVID vaccines are actually very, very effective. And because they're very effective, they trigger a very strong response in most people.
I got the second dose on a Thursday, stayed home from work Friday, just with a manageable fever, body aches,
fatigue and headache, chills, even fever. Those symptoms immediately after the vaccine are the expected response. And while they're not pleasant, and if severe, they can be treated with Tylenol, for example, they don't last long, and they are actually a signal that the vaccine is doing its job.
Our first dose was on February the 2nd, and nothing. I mean, I hardly felt it, and there were no after effects at all. Second dose was February 23rd, and again, I hardly felt it and no side effects.
Each of us have immune systems that are very different from one another, both genetically from birth, but also because of different experiences we've had with different germs.
I had the same vaccines on the same date as Dama, and also I had no reactions at all. Everything was great.
Not having a really strong response doesn't mean that the vaccine didn't work. Just means that one person has a different genetic immune makeup than another person does.
We were definitely excited.
I feel healthy and a lot more secure.
There you go, different experiences from different people there, and hopefully that doctor is able to help you navigate through some of that. The Utah Department of Health announcing a new partnership to help with the vaccine rollout. The partnership includes Intermountain Healthcare, Nomi Health, and University of Utah Health. The new partnership was launched as the Department of Health is preparing to receive around 122,000 doses of vaccine this week. State officials say that they expect the number of first doses coming into Utah from Mrna and Pfizer to double in the next week.
Well, right now, trials are underway to see how well current coronavirus vaccines actually protect children.
Yeah, KSL's Mrna Vaccines spoke with a high school student right here in Utah who is part of those trials and why she says she wanted to get involved in the process.
It feels really good.
Few people felt the needle.
When they gave me the shot, it didn't hurt at all.
As early as Cadence Eager.
Later, I started to feel pretty bad.
The 17-year-old high school senior got both doses of the vaccine in November.
A really bad headache, probably the worst one I've ever had.
Part of a Pfizer trial for people 16 and up.
The whole point of my daughter and I volunteering to do this study was just to get the vaccine to roll out as fast as possible.
Things have picked up. Now people as young as 16 with certain medical conditions are eligible.
This is the group we'd like to vaccinate.
Dr. Andrew Pavia is chief of pediatric infectious diseases at the U.
Now, there is one caveat here. Some of the people least able to fight off the virus are also not very good at responding to vaccines.
Pavia says they generally expect teens at least 16 years old to respond the same as young adults.
And we don't expect there to be safety problems with these vaccines in any of these groups. It's really a question of whether it works as well as we want it to.
A more intensive study is underway to see how kids as young as 12 years old respond.
I can't wait for that time because I'd like to see teenagers protected. I'd like to see them not be able to spread disease to their grandparents.
Pavia hopes to see the FDA sign off on the vaccine for those 12 and older before next school year. Anything below that age.
When you get down to the younger age groups, then things get more complicated. You may need to lower the dose.
Cadence continues to report to Pfizer how she's doing each week.
It's worth it to me.
And now she's one of a growing number of teens to get the shot.
Hopefully everybody can have access to it and we can all be protected.
Mrna Vaccines, KSL 5 News.
Matt, thank you. All right, when you get your vaccine, there's a chance you'll experience an immune response, especially after that second dose as you develop more COVID-19 antibodies. Now, we kind of touched on this before, but we're going to go into greater detail here. According to Dr. Brandon Webb from Intermountain Healthcare, that response includes things like fever, chills, fatigue, and body aches. These are all manageable with rest, hydration, and an over-the-counter painkiller if it's really uncomfortable for you. A small group of people may also experience a reaction. Those typically happen very quickly after the injection within the mandatory 15-minute waiting period.
And also, Dr. Webb says that if you have a reaction that isn't expected, like hives, a rash, difficulty breathing especially, that's when you should contact your doctor.
But as we've heard, it goes from both ends of the spectrum, doesn't it?
For sure.
Stick around. We'll be right back. The country's third weapon against the coronavirus, the Johnson & Johnson vaccine, is already on its way to Utah. The first shipments of the vaccine hitting the road this morning. One of those boxes had a special send-off with workers signing it. The FDA giving Johnson & Johnson emergency approval for its vaccine over the weekend. Those vaccines could be here in Utah in just a few days.
Well, tonight on KSL 5 News at 10 o'clock, we continue our Plan Your Vaccine coverage. KSL investigators crunch the numbers on whether the COVID vaccine is reaching Utah's minority communities. And lying to get the shot early, why that fib might end up hitting you in the wallet. Plus, could large gatherings make a comeback this summer? We all hope so. A Utah doctor's predictions for the summer and fall.
All right, thanks for joining us, everyone. Great to have you along on this vaccine special on this Monday. Much more to come tonight at 10 o'clock. The season premiere of The Voice is coming up next.
And we'll see you right back here at 10 o'clock after the premiere of NBC's Debris. But we leave you tonight with this live look. It's at the City and County building here in Salt Lake City, where Salt Lake Mayor Aaron Mendenhall, along with members of the City Council, are paying tribute to both victims and survivors of COVID-19. We'll see you at 10.